The Frontier Nursing Service was established to address high maternal and infant mortality rates. In the early 1900s, about 800 out of 100,000 births resulted in death, while as many as 100 out of 1,000 died before their first birthday. The high incidence of death prompted Mary Breckinridge to create the Frontier Nursing Service. Mary Breckinridge, born on February 17, 1881 in Memphis, Tennessee, pioneered frontier nursing in the United States. The daughter of a United States ambassador, Mary Breckinridge was exposed to different healthcare experiences that helped her realize that nurse midwifery was key to leading a healthy life. Widowed at age 26 and experiencing the loss of 2 children, she devoted her nursing career to improving the health of women and children. She established the Frontier Nursing Service in 1925, a model that delivered health care to rural areas in the United States. She initiated the delivery of health care to the poorest and most isolated regions of the Appalachian Mountains, traveling on horseback to provide prenatal and birthing care in communities without access to health care. As a result, the region saw a dramatic decrease in infant mortality. Since then, she has been recognized as the first nurse to bring midwifery to the United States, and for her contributions to women's health, community and family nursing, and rural healthcare delivery. During her travels and work experience, Mary Breckinridge was convinced that France had a great system of midwifery and healthcare that the British had reshaped. She adopted their midwifery program and improved the system into her own. With the help of other nurses, she went to England to obtain the training that she believed was most important to address the needs of young children in rural United States. She dedicated her life and works to them. The Frontier Nursing Service trained nurse midwives and employed nurses with the skills of nurse midwives. They originally traveled by horse to serve patients, but later opened clinics in rural areas. In 1925, the first clinic opened in Hyden, Kentucky. Soon, 12 more clinics opened throughout the Kentucky region. After World War II, the Frontier Nursing Service began training nurses in the United States. The school was called the Frontier Graduate School of Midwifery, but was later changed to the Frontier School of Midwifery and Family Nursing. In the 1960s, the organization realized that it needed to increase the broadness of the care and change its training to encompass primary health care for all aspects of the family. Care was designed to be all-inclusive, culturally sensitive, and safe. In 2000, the school received accreditation to provide a master's degree in nursing, and in 2005, the school received accreditation from the National League of Nursing. Today, the school offers programs geared toward nurse midwifery and nurse practitioners. Frontier Nursing served to extend nursing services to rural areas that had little or no access to health care. It demonstrated the relational leadership of the nurse when the nurse is the primary health care provider to those without access to health care. The nurse formed bonds with the families in these rural areas. Frontier Nursing served as an example of an initiative that was developed by nurses that has shaped our current community and home health programs. By continuing to recognize needs in our communities and to advocate for our patients, we can strive to provide health care for everyone. Nurses have a common goal: to provide the best care possible.